On the outside, Heather looks like the picture of health. What people don't realize is this young beauty is battling a life-threatening disease. Take a look.
2 years ago, I had an acute pain in my arm, and I also had chest pain, and I was gasping for breath. I was admitted to the hospital. I was afraid because I felt like I was dying. They moved me into the ICU. They began putting tubes in my body and a breathing mask over my face. They pushed air into my lungs. I blacked out. I don't remember anything from that day. I was born with sickle cell disease. I was still in my mother's womb and tested positive. Sickle cell anemia is a blood disorder. The average life expectancy was 40 to 45 years old. As a child, I was able to run, jump, and play. My parents encouraged me to be an active child. Painful episodes occurred specifically in my arms or my legs, usually in my joints. And as an adult, I've started having episodes more frequently all over my body. My pain is usually about a 10 out of a 10, and it comes on so fast. It feels like someone is ripping off a limb and pouring glass into your veins and expecting you to keep living normally. My colleagues don't know I have sickle cell disease. I'm supposed to be a normal person without any health issues. People do treat you differently. They think she's a sick girl. I like people to know me as Heather first. Sickle cell is a part of me, but it is not all of me.
Well, Heather is here along with our really good friend, Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer. So welcome, Freda and Heather. And joining us in the audience is Heather's husband, Jason. Thank you so much for being here. This is one of those diseases that many people have heard of, but really know so little about. And you've lived that, right? People, yes. they don't really get it,
no.
Right?
No, they don't. You know, my parents, they raised me like a normal kid. They encouraged me to go run, jump, and play.
But yet you were in and out of the hospital.
I was.
And how did you explain this to the other children? What did you say?
Well, I told them that it was like having a bad cold for a long period of time, except for my colds put me in the hospital.
Right, and so school was a struggle because you're always playing catch up, right?
Always playing catch up. School never really was easy for me. Grade school and even university was very tough. I walked across that stage in 5 years with my degree.
Heather is sitting here. She's beautiful, she's accomplished, she's courageous and ready to speak out. So you kind of look at her and go, so I'm sorry, what is the problem here? And that's, you know, really an issue for people with sickle cell disease because they don't know. So for starters, it is an inherited disease. In the US, primarily in African Americans or people of African descent. And essentially what happens is red blood cells take on an abnormal shape, a crescent or sickle shape, which is how it got its name. And these misshapen cells have a really hard time carrying oxygen, as red blood cells are supposed to do, and they kind of stick together. That blocks blood flow to parts of the body. What happens then? You get organ damage, and Heather mentioned some of it, joints sometimes, lungs sometimes even the brain. And in addition to that, what happens often with this blockage is what we call vaso-occlusive crises. These are excruciatingly painful crises that Heather described.
As a child, you told people you had a bad cold. What do you tell people now?
I'm honest. I tell the truth that there are days where I have to drag myself out of bed. I'm in pain every day, but there are people who say that I use my sickle cell as a crutch.
Then layer on top of that this terrible stigma from childhood to adulthood. As children, you know, is it contagious? I don't want to catch it. Why can't you come to school? Why aren't you here? You fall behind. As adults, why aren't you at work? You're lazy. So the stigma is huge.
In fact, your brother is affected as well?
Yes, my brother was diagnosed with sickle cell around age 1. And because of that, they tested me while my mother was pregnant. And I was diagnosed when I was still in her stomach.
Yeah. So it's inherited.
It is an inherited disease, and there's a lot of confusion around that too. So in order to have sickle cell disease, you have to have 2 genes, right? So inherited means that it's a genetic disorder. You need 2 genes for sickle cell, 1 from each parent. If you have only 1 gene for sickle cell, it's called a trait. So let's put two parents together, right, each with a trait. What can happen? And this is in each pregnancy, not for all of your kids. So if this couple gets together, they have a 25% chance of having a child with sickle cell disease. They have a 50% chance of having a child with the sickle cell trait, which means they probably are not symptomatic but can pass the disease along, and a 25% chance to have a child that has neither the trait nor the disease.
So when you talk to your doctor, is there a plan for regular care? Are there things that you can do?
So for people who have sickle cell, you know, stay in the game, make sure that you stay knowledgeable about your disease. Stay current with new options, resources that might be available, so stay in close touch with your treatment team. So consider participating in a clinical trial.
Right.
And then last but not least, speak up for yourself as a patient, but also to help educate people who don't know. Yeah. For the rest of us, listen, because we have a chance to bust the stigma here, not add to it.
I really encourage you, if you want information about this, you can go to gethealthystayhealthy.com, and they're going to have a lot of talking points there about identifying these trigger points, how to manage yourself in a crisis. And listen, if you have a question for Freda and I, we get together all the time, and we want to hear from you. So go to drphil.com, send us your questions. I want to thank all of my guests today, especially Dr. Freda Lewis-Hall. And we thank you for coming, educating, and raising the awareness on all this by talking about your experiences.